Hey everyone! Today we're diving into peritoneal dialysis or PD versus hemodialysis or HD. We'll focus on what these treatments mean for diabetic patients, how each method works, the risks involved, and who needs dialysis. Let's get started. First, let's talk about peritoneal dialysis or PD. In PD, the peritoneum, which is the lining of your abdomen, acts as a natural filter. A special fluid called dialysate is introduced into your abdomen through a catheter. This fluid absorbs waste products and extra fluid from your blood through the peritoneum's blood vessels. After a few hours, the dialysate, now containing waste, is drained out and replaced with fresh fluid. There are two main types of PD: continuous ambulatory peritoneal dialysis, CAPD, and automated peritoneal dialysis, APD. KPD is a manual process done about 4 times a day. APD uses a machine to exchange the fluid, typically overnight. Pros of PD include home flexibility and gentler, continuous dialysis. However, it requires management and carries a risk of peritonitis, an infection of the abdominal lining. Now let's move on to hemodialysis, or HD. In HD, your blood is filtered through an artificial kidney called a dialyzer. Blood is drawn, filtered, and returned to your body. This requires a special access point, usually a fistula, graft, or catheter. Hemodialysis is typically done 3 times a week, each session lasting around 4 hours. It can also be done at home, but most patients go to a center. If you're diabetic and on PD, you might need more insulin. The dialysate used in peritoneal dialysis contains glucose, which is absorbed into your bloodstream. This extra glucose can cause blood sugar levels to rise. Diabetic patients often require insulin, like glargine, to control their blood sugar. Both peritoneal and hemodialysis complicate glucose management. Hypoglycemia. During hemodialysis, insulin clears more efficiently, leading to a drop in blood sugar levels, especially during or after sessions. Fluid shifts. Dialysis causes fluid shifts, altering blood glucose and insulin needs. Careful monitoring and adjustment of insulin are essential. Can you use insulin while undergoing hemodialysis? Yes, insulin can be used during hemodialysis. Hemodialysis affects insulin needs, requiring dose adjustments. What is dialysate? When is it needed? Dialysate is the fluid used in PD and HD to remove waste from the blood. It contains water, electrolytes, and sometimes glucose. In PD, dialysate absorbs waste and fluid through the peritoneum. In HD, dialysate draws waste and electrolytes out of the blood. Who needs dialysis? Dialysis is for patients with end-stage renal disease or advanced chronic kidney disease. It helps with severe fluid overload, high waste products like urea, significant electrolyte imbalances, and uremia symptoms like nausea and fatigue. To wrap it up, both peritoneal dialysis and hemodialysis are life-saving treatments for kidney failure patients. Insulin management is key for diabetics, especially in PD due to glucose in the dialysate. Understanding each method's pros and cons helps tailor the right treatment for each patient. Please like, share, and subscribe for more. See you in the next one.